New parents want to give their babies the very best. When it comes to nutrition, the first food for babies is breast milk. From FDA Consumer article, Breastfeeding Best Bet for Babies, published in 1995. Breastfeeding is crucial to an infant's lifelong health. My goal today is to persuade you that breastfeeding is the best choice for nutrition for an infant. I'm sure that everyone here knows someone who has a baby. Some of you may have children of your own, or you may even have one on the way. According to Promotion of Breastfeeding Beyond the Benefits, International Journal of Childbirth Education, there has been about 75% increase in women who breastfeed. As a young married woman interested in having children in the future, I have been researching the benefits of breastfeeding, and I truly believe that it is the finest option for an infant. At the end of our time together today, I hope that you feel the same. Today I will talk about the health benefits of breastfeeding for both mother and baby, along with socioeconomic, psychological, and intellectual benefits. Let's begin with what matters most, the health benefits for the baby. In a 2013 article from the British Journal of Midwifery titled Benefits of Human Milk and Breastfeeding, it states that the World Health Organization recommends exclusive breastfeeding for the first 6 months of life due to the fact that it reduces the risk of allergic disease, obesity, high blood pressure, and high cholesterol later in life. According to womenshealth.gov, colostrum, which is the initial breast milk produced, is very rich in nutrients and antibodies to protect your baby. Breast milk fights disease like nectarizing enterocolitis, lower respiratory infections, asthma, and type 2 diabetes. From Breastfeeding Best Bet for Babies, published in 1995, breastfed infants have lower hospital rate admissions, ear infections, diarrhea, rashes, and other medical problems than breastfed babies. Human milk contains just the right amount of fatty acids, lactose, water, and amino acids for human digestion, brain development, and growth. 80% of cells in breast milk are macrophages, which are cells that kill bacteria, fungi, and viruses. Human milk contains at least 100 ingredients not found in formula. No baby is allergic to their mother's breast milk, although they may have a reaction to something the mother eats. Now that you have heard the health benefits of the baby, we will move on to the health benefits for the mother. Not very many people realize that the health benefits aren't just for the baby when breastfeeding. There are some for the mother also. Womenshealth.gov states that breastfeeding is linked to lowering the risk of some health problems in women, including type 2 diabetes, breast cancer, ovarian cancer, and postpartum depression. Skin-to-skin contact can boost the mother's oxytocin levels, helping her with milk flow and help to reduce stress. Another way it helps reduce stress is it requires the mother to take a break, take time to spend with her child, relax and feed her, and approximately every 4 hours depending on the baby. So that's a nice substantial break and gives the mother time to relax and reduce her stress. According to Breastfeeding Benefits from Health Source Consumer Edition, published in 2013, breastfeeding can also help you lose weight after giving birth because it helps you burn extra calories from breastfeeding. As you can see, the benefits for the mother are abundant while breastfeeding. Now let's discuss the socioeconomic benefits. Socioeconomic benefits of breastfeeding are not only beneficial to each individual family, but to society as a whole. First, according to many womenshealth.gov, if 90% of families breastfed exclusively for 6 months, nearly 1,000 deaths among infants could be prevented. The U.S. would also save $13 billion a year in medical costs. Fully breastfed infants have lower medical costs than never breastfed infants. Breastfeeding is much better for the environment than bottle feeding because it reduces the amount of trash and plastic waste produced by formula cans and bottle products. During an emergency, breastfed has many benefits, including it protects the baby from contaminated water supply. Breast milk is the right temperature for the baby, so it helps to prevent hypothermia when the body temperature drops too low. It is readily available without any other supplies. According to Breastfeeding Benefits, published in 2013 in Health Source Consumer Edition, breastfeeding can save you up to $1,500 a year because you don't have to buy bottles and formula. Another way it can save money is not having your babies too close together. According to the article, breastfeeding helps prevent pregnancy during the first 6 months after you give birth if you do the following. Only feed your baby breast milk. Feed every 4 hours during the day and every 6 hours at night, and if your menstrual periods have not returned. We've reviewed the socioeconomic benefits of breastfeeding. Now let's proceed to the psychological and intellectual benefits. Some people forget about the psychological and intellectual benefits of breastfeeding. Some psychological benefits from breastfeeding Best Bet for Babies says that many psychologists believe that a nursing baby enjoys the sense of security from the warmth and presence of the mother, especially with the skin-to-skin contact during feeding. Parents of bottle-fed babies may be tempted to prop the bottles up in the baby's mouth with no human contact. Human contact is very important to an early sense of attachment. There are also intellectual benefits of breastfeeding. In a US Today article titled "Breastfeeding Really Might Do the Baby a World of Good" by Michelle Healy, published in July 2013, says that in the study in the Journal of JAMA Pediatrics offers new evidence of intellectual benefits of breastfeeding. Based on data collected from 1,312 mothers and their babies, the study suggests that infants who are breastfed for a longer duration during the first year of life have a higher score on measures of language recognition at age 3 and on verbal and nonverbal recognition IQ measures at age 7. From the information stated above, it is obvious that breastfeeding is giving your baby the very best start in life. Today, I have provided you with the information regarding breastfeeding, including health benefits for both mother and baby, socioeconomic, psychological, and intellectual benefits. I have stated many reasons why breastfeeding is advantageous for an infant and mother. I hope that I have persuaded you to now believe as I believe, if you didn't already, that breast is best. All in all, you and your child can only benefit from breastfeeding, so why wouldn't you choose it?